morning, everybody. I'm Erica Simon. This is Stephen Romo. This is Dr. Asim Shah from the Baylor College of Medicine. We are doing a special Facebook Live to answer your questions this morning all about COVID-19.
Yeah, we know you guys have a ton of questions. You've shared them with us before, and we spoke with Dr. Shah about some of these, and now we have a whole new set, so we'll jump right in, getting those answers, and you can continue submitting those questions throughout this Facebook Live as well.
And we want to start off with the obvious. We know what people are seeing in the stores. We know what people are seeing online. Folks are just downright panicking. Let's just call it what it is. I mean, we understand the need to feel prepared, to be prepared for the unknown, but it's escalated in some cases. Some folks are fighting in the stores. They're pulling the last supplies. I know I've been trying for days just to find a pack of baby wipes for my baby, not as a panic shopper, but just for an everyday need in my house.
Yeah.
And so finally today, I was almost in tears, but I did finally find some. So, Doctor, let's just start with that. I mean, where are we at just kind of with our psyche right now? What are people feeling, and how can we overcome some of that?
Sure. Fear of unknown is normal in this situation because nobody knows how much is going to escalate, what's going to happen, whether things would be available or not. People are forgetting the fact that this is very different than Harvey, in which everything was closed and all transportation, deliveries would be open, so that won't be affected. And when they go and buy, if we all think that we buy a little bit as opposed to like the whole truckload of stuff, then we may leave something for you or anybody else. So panic is normal, but we are getting a little overboard, and one of the reasons for that is social media, electronic media. Everybody's WhatsApping long lines around one store outside and this and that. Understand that they need to know, but they need to also be careful. And if you're panicking, why don't you go a little early or a little less rush time, but don't stock up because you're going to cause more problem for other people. But it's very normal. The only way to deal with it is understand that as much as it is a deadly disease, the mortality rate is less than 2%. 98% people are fine. 80% of the people with corona have no symptoms. So why cannot we focus on the positive as opposed to just on the extreme? I think that's what is happening. Everybody's focusing on that extreme part as opposed to the positive part.
Something that happened to me yesterday when I went to the store, I was just planning on grabbing a few things, but seeing people with carts.
That's exactly
full of
what
stuff,
happens.
I was like,
maybe I need to get
some canned food. Do people sort of feed into each other?
Right, exactly. That's the reason I'm saying that all those transmission of pictures and videos from people to other, that oh, this much line, somebody was there 6 o'clock or so, everybody who's not even willing to go or was willing to go now will go because, oh, I don't have it, I need to go. So it kind of is a ripple effect. If we all calm down a little bit, it is much better, and maybe the stores have to have a little bit of a limit that buy 1 or 2 or something, because everybody needs to have some stuff. That's perfectly fine. But if we all going to stock up, we're going to increase the panic.
Don't go
People
overboard.
blame media. You mentioned earlier, people blame media, and we saw that yesterday and day before. And yes, media shows things, but it's media's job to give you information, first-hand information. If somebody is so much bothered and media makes them anxious, they don't need to watch it all the time. They can watch it first thing in the morning or maybe one time. And even if that makes them anxious, just read it on online. Why? Because online has no emotions. So you can read it. Just read it like on abc.com or something. But media has to give information. So.
And I think it's important that all of us get the facts and think calmly and clearly right now, because when we're in a panic, we just start making out of control decisions and things get just societally out of control.
Correct.
Let's jump to some of the questions that have been submitted already via Facebook and from some of our viewers. I'll just tell it verbatim. Is it true that the virus reacts to heat? For example, are we expecting in the warmer weather that the virus could gradually be controlled?
We are hoping. We don't know. Nobody knows anything about the details. Remember, coronavirus has been out since 1970. COVID-19 is a novel variety of coronavirus, so nobody knows. So the simple answer is we don't know. We hope. But there is another caveat which people don't think, that even if the virus is done or killed by heat, some people will be coming from cold weather to a hot weather place, and they may bring it. So it's still better to be careful. We have to be careful. We have to still keep washing our hands. You saw me check, using sanitizers 5 times. We need to do that. Why not?
Yeah,
so
and you did the elbow bump with me. I tried to shake
exactly.
your hand.
You tried to shake my hand, and I love you, but I did the elbow bump.
There you go.
Exactly.
I keep got to hear that. I got to hear that over and over again before I finally understand.
I'll ask another one, and then I'll let Stephen ask you some of these. How can I keep my 7-month-old daughter from getting COVID-19? That's a valid question. I have a 1-year-old, as many of you know, and so our first thought is for our young children, although they don't seem to be as
affected as the elderly. You're absolutely right. So it's the same answer. How can you keep your elderly parents or grandparents away from it? Again, simple thing. How does the virus spread? The virus spreads from your eyes, nose, or mouth droplet. Keep washing your hand, keep washing your face with soap. 20 seconds. Sanitizer is okay, but soap is even better. Why? Because the biggest mistake people make with sanitizer is that they use sanitizer like this, whereas you have to do the whole thing very nicely and gently in every single part, and including your nails and all of that. If you can do that, keep doing it. That way your family is safe, your kids are safe, your parents are safe. Also try to wipe the doorknobs also, especially if you're coming from outside and you haven't washed your hands. Maybe wash it with a sanitizer or one of those napkins which are sanitizer napkins or so. Again, prevention is better than cure, and right now the biggest problem is panic. That's more than the disease. So.
Yeah, that's definitely a great message. Another question here, people are worried about not being able to travel within the United States right now. That's the question they have. What is the possibility of not being able to travel back? We see that in other countries right now.
Yeah. Again, that's a question more so for transportation authorities, but what we are seeing right now, certain areas are more affected, like New York and Washington and California. So those are the areas it's better to avoid right now, and those areas perhaps may increase. Right now there is a state of emergency or disaster in Texas also, as you know. Use your judgment. If you can avoid, definitely do. If you think you have to go, take those precautions which we have mentioned, and we'll continue to mention again and again. But certain areas are definitely better to avoid. Most of the conferences are cancelled. Marriages are being downscaled also, because right now the recommendation is no more than 250 people. In some places they're even saying 25. So all those things are going to happen, and I think if somebody's worried or immunocompromised, especially if you are on chemotherapy, immunocompromised, elderly, definitely don't go. Most definitely don't go.
And when you mention that, actually feeds right into this next question. This is from a specific a woman who sent this in. She said, I'll just read it to you. I'm feeling badly, severe headache, body ache, productive cough, but no temperature. I came home from work early. I'm an older woman with asthma. Is there something I should be doing in this case?
Simple thing is she needs to definitely contact her primary care. Usually the biggest sign of this virus or symptom is fever, 100.4. That is the biggest sign. Cough usually is dry, but again you can have atypical presentation also. Since she has a history of respiratory symptoms, I think it's better to contact her PCP. Definitely keep monitoring her temperature at least twice a day, if not more, and if something changes, even more so. I would not suggest to walk into the PCP's office without talking, because what if you have corona and you walk in, then you can give it to other people. So please contact and get instructions from them.
Call first. Yes, we keep hearing that you should call first.
That's another thing people are doing. Yes,
Do an e-visit. Yeah, there you go.
Most of the people are trying to do e-visits because it's much
many
better.
options there. I think that there's another question. I think.
I'm sorry.
No, you're good.
Speaking of vulnerability, somebody specifically wants to know how this affects someone who's HIV positive.
So HIV positive is a disease now which is much better cured and treated than it used to be, but there are different kinds of HIV positive. Somebody who's just a carrier is usually not a compromised person, but somebody who is suffering from severe HIV disease, not being positive, meaning suffering from AIDS, perhaps would be immunocompromised, and if their CD4 counts are lower, it will affect them more harshly and more severely. They definitely need to stay home and stay where they are. But if somebody is just positive and everything else is fine, they will be less affected. Again, rule of thumb better is to stay home. When in suspicion, stay home.
Right.
When in suspicion, definitely stay home, don't go. But it will depend on the level of HIV you have. If you're just positive with the normal CD4 count, you may be okay, but if your CD4 count is low, most definitely don't go out.
That's very good advice.
And another one, speaking of going out or not going out, someone's asking about food. This particular viewer says they are not going to dine in restaurants at this time. They say they just don't feel like dealing with it, but they're asking is it safe to eat to-go food, fast food? What kind of is the rule here?
Exactly similar precautions whether you go or not go. So if you go to a restaurant, hypothetically, you can take some wipes, some sanitizer wipes, and clean the table and clean the stuff and do it. Again, it is going to spread from nose, mouth, and your eyes. So if you wash your hands, or if you clean your hands with a sanitizer, don't, and if you touch your, because unconsciously sometimes we touch our face or scratch it or there's itching or something, that's how it's going to spread. It doesn't spread with a pizza box necessarily. But if you're worried about it, still wash your hands, take the pizza out on a plate which is cleaned at your home, and do that. There's so far no evidence to show that food is going to spread it without those three things I mentioned. But yes, if the virus is on a table, somebody sneezed on a table, it's on the table, and you touch your hand and you haven't washed your hand, and then you touch one of those things, certainly it can. So just those precautions, and then wherever you are could be fine.
And I want to ask a quick question before we go to any Facebook questions. We're done with the early list. This sounds terrible, but I'm going to just say it. From a mind perspective, for people who we continue to see out in the stores, we've talked about this for the past day. People who go out in stores continuously keep coughing uncovered, and just going against these rules. At this point, it's becoming socially irresponsible. Some officials and authorities would say.
Right.
What is with that? Are people not hearing what to do, or they just don't care? Is it just a slip of the mind in that moment? Like, why are we still not having, as much compliance as we need during this pandemic?
This is exactly what I said in the beginning. That's telling you that the panic disorder is more than the disorder, because if they are looking at the disease, they need to take those precautions which you just mentioned, right? So they're not doing that, whereas they're panicking and bulking on food and doing this and doing that. So they're looking at part of the thing, but not the whole scenario. And truly, you're right. If they're doing that, if they have, anybody can have a cough, maybe use a mask or just use your sleeve or something, but don't cough on other people. We're not saying that nobody's going to have cough, but stay home, use a mask or something. Take precautions and wash hands and do all those things, but people are not doing it. So it's our responsibility also to try to have some social distance as much as possible. They say 6 feet. Sometimes it's possible, sometimes it's not possible. So if it's not possible and you somehow accidentally come in contact with somebody like that who has sneezed, without obviously you knowing or anything they've sneezed, what do? Sanitizer. Use sanitizer, wash your hands then, or go and wash. Every place has usually a restroom. You can go and wash your hand, wash your face with soap for 20 seconds. That will kill it. That will kill your worry. But yes, they need to act responsibly, and they are not, and they're only focused about that panic, phobia, not the disease. They want to stock things, but not to take care of how to spread.
It's still being nasty. Let's just call
exactly.
it. I'm gonna hold my breath and people just start opening and coughing and sneezing like that in the store.
It's not even holding your breath. What if it comes on your hand and then you touch it? So wash it.
Breath won't help.
Wash.
Do we have more questions?
Yes. So one of our viewers is asking if face masks are needed and do they really work?
Okay, so I'll just have to repeat that since she's not mic'd up. Are face masks needed, and do they actually work?
Yeah, that's a very good question. I work in a hospital, and face masks have disappeared from a lot of even hospitals. We have to keep it unlocked because people are taking it home and all of those. And while it's wrong, they shouldn't be doing it, but they are also worried and all of that. So there are two kinds of face masks. One is a surgical mask, which is what you usually see, even in movies or so. That's what you usually see, that people are just putting that surgical mask. Surgical mask, if a person is infected, does not stop your spread, because the molecule is so tiny of coronavirus that it doesn't. So if somebody is infected meaning a diagnosed case, or a PUI, which is person of interest, meaning they're testing and they're trying to figure out you have coronavirus or not, those people end up using N95 masks, which is N95 is a specialized mask which is used in ICUs or so. And if that happens, the hospital will provide you that. So that is for people who are infected, or if somebody goes in close contact, like healthcare professional, with those people who are infected. Regular face masks are not for people who are not infected. So if we are here and we are not infected, we don't need to use any mask. I'm going to go and work in the emergency room. I'm not going to use any mask, although I will be in the ER. Now, if I see a patient who is infected, then I would have to use a mask. That's very different. But anybody who's not infected, normal people don't need to use a mask. One more thing though is that if a healthcare worker, because a lot of hospitals now have tents outside, we are screening patients before they enter in. We call it epidemiological screen, meaning we ask, have you traveled? Have you traveled in the last 14 days? Where did you travel? And if the travel is within the last, those 6 countries, which we are calling the level 3 countries, then we ask the history of fever, cough, and respiratory distress or shortness of breath. In that scenario, the people who are at the front line, they can wear a surgical mask. Those frontline nurses or people, that's it. But otherwise, nobody else needs, because they are the front line. Why? Because they may accidentally come in contact with those people. But normal people, healthy subjects, do not need to wear a face mask. It doesn't even help, and you don't need to wear it.
Just wasting money.
You just waste the money, and that mask can be used by somebody who really needs it.
Yes, sure.
Washing hands is way better than your face mask. Washing your face is even better.
Wash those hands, wash those faces. All right.
So for those that have to self-quarantine themselves, how long, once they recover, how long until they no longer have to quarantine themselves?
The question is about the timing for the quarantines.
Yeah. What they say is that if you're coming, for example, you landed today from somewhere which is on a list and you have to be quarantined, they will do 14 days from the day you land.
Okay.
Why? Because they will assume that you may have been in contact with somebody even till you left that place. Although it could have been 3 days ago, but they don't know, so they will perhaps do the 14 days from the day you land, number one. If you know a very clear history that I came in contact with a person because of work 5 days ago, and you have a clear history and then you didn't see that person, then they will count perhaps that day as a first day. So it's 14 days, but depending on how you count it. But yeah, right now it's 14 days self-quarantine. And self-quarantine, people think it's a bad thing or so. In today's day and age, you don't need to panic even about that. You can watch TV, maybe not watch the news all the time, maybe
Right.
a little bit, watch some comedy shows, some movie or something. Spend your time. You have your phones, text, talk, chat, whatever. Even call somebody.
Yeah.
That doesn't hurt, right?
It would be way worse 20 years ago.
Exactly. 20 years ago, I know it would have been
so bad.
very, very tough.
Rougher.
Yeah.
Yeah.
Okay, anything else?
So one of our viewers who's constantly coughing up and spitting up phlegm, is that related to the coronavirus? She's just wondering what more the symptoms are.
So this woman sounds like she has a wet cough. We hear the coronavirus often has a dry cough.
Correct.
These are like some individual symptoms. But what would you tell
Yeah.
someone?
I mean, first of all, we have to remember that people were having colds even before coronavirus.
Right.
People were having flus even before coronavirus. People were having ear infections, throat infections, tonsillitis, other things, even before coronavirus. So, of course, that will still continue. So, a lot of people will have those kind of symptoms. If you don't have fever, if you don't have any reason to believe that you have coronavirus, meaning exposure, then you may have something else. Call your primary care still and discuss, because they know your history more than any of us. And they will see that if you have a respiratory problem or you're elderly or so, they may do it based on that. So it's difficult to advise without knowing anything,
Right.
but they need to call their primary care. But also remember that not everything is going to be coronavirus. Other things are
Very
still
good.
existing.
In this day and time,
Very
people
good.
don't
Everything,
shoot
yeah.
up having it if
Yeah,
coughing.
you can have tonsillitis, you can have ear infections, you can have
We're
cold.
at the end of the flu season, right? So
Yes,
people
you can have
start that
anything.
one. Yeah.
So don't ignore that those things are still going on, and hopefully you may have that stuff.
Right.
Get it checked, but at least call your primary care. They will know.
Very good. Call that primary care doctor.
Do you expect this to die down soon?
Oh, that's a good question. You sort of touched on this earlier.
Of course,
What is that?
I'm no expert in saying that we expect it to die down soon, and nobody is. But what we have seen from the evidence, for example, in China, it started in fall of last year. They self-contained everybody very quickly and really very strictly, which I don't think we can do in this country because China is different than US.
True.
But because of that, it kind of died down in China. The cases have been very few now, and it's kind of plateaued. So it took, 2-3 months at least
Right,
there.
wow.
We are hoping that once we, do all the precautions, in a couple of months it should die down. Nobody knows that time period. Is it going to be 8 weeks? Is it going to be 12 weeks? Is it going to be 4 weeks? We all can hope that it's quicker than not. But that's what we are hoping. There's no evidence to say that
Right.
it is going to do it
It's
or
a
not going to
novel
do it.
strain, right?
It's a novel strain, and but yes, we hope that it should be contained. That's the word I think we should be using. It should be contained with the precautions we are using and we should be doing. Not the ones which you talked about, that still coughing and sneezing. No, then it's not going to die down.
Right.
Then it's going to
Wash
be a
those
problem.
hands, cover that cough.
Then it's going to be a problem.
All right.
So we see a lot of people stocking up on food right now, but do people also need to stock up on like their psychiatric medications? There's one viewer that has a 2-year-old son who has 2 weeks worth of medication, but do they need to stock up on?
So this is a mom asking, or a parent asking about a child with medication for a 2-year-old. That's something we hear. They say always have 2 weeks on hand. I think
Yeah.
the fear there is if someone is told that they need to self-quarantine, what would be the situation there? What would you tell someone?
So people need to understand what is self-quarantine. Self-quarantine is you are in one area of your house, maybe a room, and you are there and nobody's going. But first of all, if other people are living at the home, they can get the medicine and they can even leave it at your door if that is the case, and you can take it. If you are the only one at home, somebody can deliver it at the doorstep and you can open and get it. So it's not that you are in a situation that you will have complete lack of contact or delivery or anything. Those things are happening. It's a good idea to keep your medicines if possible. Certain medicines can be given 3 months and doctors will definitely give it to you. But certain medicines cannot be, and they may be controlled substance and doctor may be worried about it and they may not like to give you more than 30 days. Check with your doctor. If you can get a 3-month supply, this is the time you should and keep it. It's a good idea always, because while everything should be open and continued and we don't need to panic, but if you can get a 3-month, go ahead. But if your doctor doesn't, they may have a reason, then don't worry, because again, you're not going to be completely cut off from life.
You're not on the moon.
No.
People can
Yes,
still bring
exactly.
you.
Even moon people are sending stuff.
That's
these
true.
days,
You
so-
can step on the moon.
Exactly.
International Space Station. Okay.
So many schools have shut down and closed campuses, but they're giving out free food at those same locations. Is it safe for people to go get that free food at that location?
Because there's large crowds.
Yes.
That's right,
HISD
yeah.
started that today, giving out
Schools
these
handing out food,
food
and there's large
programs.
crowds that are showing up. I mean,
Right.
hundreds.
That's your individual decision. So again, right now the recommendation is 250 people or less. If you feel your school has more, you can certainly avoid. If you feel that there is a time it will be less than 250 and you want to go, that's fine. Again, if you go, wash your hands before you enter, wash your hands before you leave, because even if one person in school has the infection, they're going to touch that doorknob and other things. So keep washing your hand. You can kill the virus if you keep washing your hand. Use your individual judgment on that. I don't know how long they will continue that, but let's see.
Moral of the story, you gotta keep those germs off.
Yes,
As much as possible.
yes.
Wash those hands.
We had video of this earlier. It looks like the lines were outside, outdoors, which it seems like open air. That seems safer than being in an enclosed space.
Open air is, yes, a little bit safer in that sense, though the still thing is, if somebody is, like she mentioned,
Close
just next to you
together,
and
right.
sneezes,
Yeah.
it can happen.
Doesn't matter if you're
Right?
over there.
It can happen, especially small kids may not know. That's also our job, to educate kids. We need to educate kids how to wash hands. We need to show them even videos. There's so many videos available. Show them how to wash hands. They will actually make a habit of it because they like this practice. They will think it's a good exercise and good fun time. They will do that. They will do it even more than you want them to do, which is okay at this
Let
time.
'em go,
We are seeing that, and that's okay.
Yeah. Okay. All right. Thank you so
Good
much.
stuff. I think that covered a bunch of bases, guys.
Absolutely.
And we're
Thank you.
always available on our social media pages. You can email the station. You can always get your questions to us, even though we're going offline right now.
Yeah.
We're always here for you.
I would just like to
As
add
best we
one
can.
thing at the end, which is that there are 3 group of people which are more vulnerable. One is people with mental illness and substance use, and second is kids, and third is first responders like physicians and nurses. They are the one who get stressed more. But the only way to control their stress, especially kids' stress, and I mentioned that yesterday also, is if parents are calm, the kids would be calm, because kids see what parents are doing. If you are panicking and you're stocking everything and your home is a warehouse right now, they will be panicking also. So please don't panic, because if you panic, it will transfer to them, not a good thing. You need to be calm so that they can be calm. And don't make panic a bigger disease than the disease itself. And that's it.
Very well said. Everyone just take a deep breath.
Yes.
We're all going to get through this. We're
We'll
all
make it.
in this together. Dr. Shah from Baylor College of Medicine joining us here, answer all those questions. Thank you so much.
Thank you.
And thank you guys so much for joining us. We'll see you next time.